given your government background, assuming there's no changes, that it goes through the comment period and no changes, what do you think the impact of the new MU program promoting interoperability is going to be on healthcare?
Not enough. And the reason is that we keep pushing interoperability that's based on patient matching. And I think except for actually positive person identification, all the pieces that we need are already in place in the private sector. So I had pushed for a private sector approach to this. But I think having the ONC push for interoperability is really important. I would like to see them look for a combination of biometrics and a user-selected identifier like we use with every other product that we have, for example, email, Facebook, whatever, to be able to help identify those naked and unconscious people who show up in our EDs. Not to mention the people who come through the front door but have very common shared names.